Hi, this is Danielle Ofri. I'm a primary care doctor at Bellevue Hospital in New York City in the United States. Bellevue Hospital is the oldest public hospital in the U.S., and I'm also a clinical professor of medicine at New York University School of Medicine. I am so very honored to be chosen by the Global Listening Center. I am so impressed at all the hard work and good work that the Global Listening Center does. In my day job with patients, communication is the most important medical tool, the most powerful medical tool that we have. And when I wrote the book, What Patients Say, What Doctors Hear, I wrote it because there are so many miscommunications, and that what our patients say and what we hear are often very different things, and vice versa. And this is one of the leading causes of medical error. So if we want to tackle the epidemic of medical error and improve patient safety and medical care for everyone, communication is the place to begin, and listening is the place to begin. We see it in the doctor's office, in the emergency room, in public health crises like the COVID pandemic, in political communication, that listening and communication is essential. And without listening, we can never communicate effectively. One of the ways that I've learned about listening is through taking music lessons. I've been studying the cello now for a couple of years as an adult. And, I used to play piano, and it's very easy to find a note in the piano. An F sharp, it's where the F sharp always is. But on a stringed instrument, there's no marking. And the only way to know if you found the F sharp is to listen. It's only when your ear tells you that you've gotten the right note that you know that you're in the right spot. And so when you learn a stringed instrument, you have to really squint your ears to listen so deeply and so carefully to find where the correct note is. And then there's even a step beyond that. You have to listen for how to make the note beautiful. Because in music, it's not just that the notes have to be correct, they also have to be beautiful. And I think that's an important metaphor for those of us in healthcare. We don't just have to listen to our patients. We have to make sure they're really heard, that we hear the beauty in their stories, the beauty in their words, the urgency of their needs, and that all comes from listening. And one of the other ways that we try to promote listening is through literature and the arts, particularly the written and spoken word. I edit the Bellevue Literary Review, which is a literary magazine focused on the poetry, fiction, and nonfiction about health, illness, and healing. And we find that using the creative means of communicating, the creative ways of listening to a poem, to a story, listening to the patient's voice, to the caregiver's voice, to the nurse, to the doctor, to the family, to the patients themselves, to their children, to their parents. Everyone has a story to tell, and they may tell their story through a poem, through a nonfiction essay, or through a made-up fiction, which of course can be the great lie that tells the truth. And by using literature and a literary magazine to explore this method of communication, we can emphasize the power of listening through the arts. This year happens to be the 20th anniversary of Bellevue Literary Review, and we're so excited to share our world of creative writing with a larger audience, and welcome you to read and also to contribute. So thank you to the Global Listening Center. Your work has been foundational in the academic community, in the healthcare community, and in the world at large. As we look at the civil strife, the political strife, the public health strife, there couldn't be a more important time for a global listening center to exist. So thank you for your good work, and thank you for everyone who has been part of this.